Thank you very much, Farhana. I'll just share our screen with you and presentation. I'm hoping that you can now see that. Did we want to just check that people can see that and hear that okay, Farhana?
Yes, actually, I'd better check that people can hear. If people could just message maybe on the Zoom chat that they can hear us. I think that was just a quick test to make sure people can hear Lisa. Brilliant. I'm getting some responses.
Okay, thanks very much for confirming. That's great. So thank you for everyone who's joining us this afternoon on this sunny day. I'm coming to you from Brighton and not Kent. We thought we'd like to start our presentation as the first in the series of presentations on social care research by really kind of setting the scene a little bit for the context of social care research and for the perspectives that can inform and strengthen the research. And we hope to really show you that in terms of approaches to involvement, perhaps these don't look quite so different as those you are probably very experienced with in terms of your health research portfolios. As Farhana mentioned, I will hand over to Jennifer, who will lead us in a short case study and discussion. So we really look forward to your engagement in that. Okay, we have to do a short disclaimer as we are representing the Quality, Safety and Outcomes Policy Research Unit. So views that Jennifer and I express are our own and not necessarily representing NIHR or the DOH. So we wanted to start by acknowledging that perhaps being approached as advisors for input around social care research applications may leave you feeling a little like healthcare is from Venus and social care from Mars. And so we wanted to provide that context and perspective to start us off. So adult social care research, or adult social care more broadly first, is accessed in a way different to the NHS, as you may already be aware. So not universal services, but access that is assessed and based on an individual's needs and means. The policy making that influences social care itself is centralised and with local implementations in local authorities. So social care that's delivered is done so in a variety of settings, including people's homes, residential, nursing homes, in the community, and also includes NHS settings. Social care services themselves are also a mixture of statutory, private and independent sector and third sector provision. Funding is also mixed, some of which is funded by the state, and there is a large growth in self-funders. The workforce in social care is also incredibly diverse. So we have a professionalised network of people working in social care, such as social workers, nurses, occupational therapists, and registered managers. But we also have a large non-professionalised workforce of carers and personal assistants. So this provides a little bit of the landscape of social care and where research might be happening. This research could be looking at the provision and receipt of care and its impact on an individual's quality of life. It could reflect workforce issues or commissioning, funding and organisation of care. And of course, sometimes it will cover the integration with healthcare itself. So what are the perspectives that might be being sought in social care research? So there's a wide range of needs and client groups who'd be accessing social care services. So some of them are listed here on our slide: older adults, people with learning disabilities, autistic people, physical, mental health problems, physical disabilities, and of course paid carers and unpaid family or friendship carers. Some of these groups in other research contexts, and indeed perhaps in some large-scale health research projects of the general population, might be considered under the bracket of seldom heard groups, but tend to be more the bread and butter of social care research. So we need to think about accessibility of approaches for both the research participants and for the lay involvement in research. I know there's subsequent webinars that Farhana will be signposting around working with older adults and people with learning disabilities. And I think these will be really important, not only to think about the research participants that social care researchers might be working with, but should also inform approaches to involvement as well. Researchers will also need in their applications to think quite broadly about who uses social care, as projects might require a single perspective from one of those groups or a cross-cutting and variety of perspectives. And of course, where workforce issues are the focus of research, involvement still needs to consider the impact of the end user. So workforce issues will affect on the processes and outcomes of services and care, and therefore researchers should also be seeking to involve those receiving care in those workforce-related programs of work. We also wanted to say just a little about terminology and something just to be aware of both in applications and in working with people. Some individuals may reject certain labels that we may commonly use and take for granted. So, one issue that you may want to be aware of is that people with a learning disability, for example, prefer person first language, person with a learning disability. Autistic people, on the other hand, do not always prefer this and sometimes state a preference for identity first language, hence autistic person. Of course, it's important to find out and ask about these things. Terms like service user or carer may also not necessarily be welcomed. It's important to try and limit or avoid the use of the term PPI. This creates a space for patients' views, but not necessarily for people who experience using social care services or their carers. So they're not patients in a typical medical sense, and that language may be somewhat off-putting. We thought it also key to highlight how we refer to our public members, our lay members who are involved in our research. So in PSSRU and the CUSO Policy Research Unit, we talk about lay research advisors. Sometimes we shorten that a bit naughtily, I think, to research advisors. I know certainly that can cause some confusion, as that has a very different meaning within the RDS. But I think worth mentioning and being aware of. Other people will talk about public contributors. Of course, there's no right or wrong answer for this, but the best advice to researchers is to check with the people they're involving how they would like to be addressed. We also wanted to just suggest a few places where social care research could find people to be involved and advise on their projects. So we have our own public involvement research advisor network, for which at PSSRU and CUSO, for which we can broker involvement if that's of interest. Of course, approaching pre-existing groups in local authorities, local areas such as self-advocacy and carer groups who may already have consultation committees set up who could give direct feedback or be a good ally and source of advice. Voluntary organisations, we've listed a few there to be aware of. Another route to access potential lay research advisors. Of course, with these organisations, establishing some longer term relationships in order to work together around research will be important if you want to facilitate their involvement. And of course, people in research is another option. So what about the how, the opportunities for involvement? In the CUSO PRU, we have a PPI strategy and frame public involvement in the way offered here by Staley and Barron as conversations that support two-way learning and not as an intervention or a strict methodology. When public involvement is framed in this way, we can apply a wide range and sometimes the same approaches for involvement as in health research. And these simply need to be tailored to the context and needs of the people we're involving. So a person-centered approach which focuses on the quality of interactions between the researcher and the public and what each have learnt is what's important. With the focus on quality interactions, Perhaps we can see that PPI for health and social care, perhaps on the same planet after all. In grant proposals, looking out for the scope and opportunities for these conversations to happen is going to be key. So there may be advisory groups that people can join, but what other opportunities are there for richer interactions that can be created to establish this process of two-way learning? We suggest that these can be cultivated at a number of stages of the research cycle, all of which I'm sure you are most familiar with. I just wanted to highlight a couple of examples from research in PSSRU at these different stages of the research cycle to give you a little flavour. So in thinking about identification, prioritisation of projects and early involvement really in the preparation of projects, a PSSRU project on application looking at social work role in primary care, having an early opportunity that was funded for the researcher to have a conversation with a lay research advisor led to the experience of that advisor being seen as invaluable and then becoming a co-applicant to that bid with the intention that they will continue working throughout the life of the project. When we move on to the sort of action zone, so the undertaking and analysis work, there's still opportunities there to involve people, making sure they're consulted on issues arising in the solutions, materials that are provided, making sure they're accessible. We can go further than this, of course, and involve research advisors as peer researchers. So a PSSRU research project on shared lives involved people with learning disabilities as peer researchers, of course requiring time and committed development of resources to train and support them. Then of course we move on to the feedback area of the research cycle around dissemination and implementation. Again, a clear role can be made here for lay researchers advisors to contribute should they wish to. In a PSSRU project on recruitment and retention in the social care workforce is a largely secondary data analysis project. The opportunity for lay research advisors to attend, engage in and co-facilitate workshops at the end of the research is part of the lay research advisor's role description. Of course, in dissemination, you can also consider the lay audience and opportunities for co-presenting and co-authorship. All of these opportunities allow research advisors to promote the findings within their local and national networks too. And just a final point from me, that throughout this research cycle, there should be a continuous cycle of feedback between the research team and the advisors. This is important to ensure that the impacts recorded and fed back. So a you said, we did format can be quite helpful there. This shows respect to people involved and also values their involvement. It shows how they influence the research and can inform the write-up and publications. So I'll now hand over to Jennifer to take you through the case study.
Hello, everybody. Somebody just open your mic and check that you can still hear us. Yeah, right. Thank you. Thanks very much. So really nice to be here. An amazing number of people by the looks of things, and all sorts of familiar names popping up on my chat. So thanks very much for coming. Welcome to my Seaside Art Gallery home, which isn't quite as professional as all you people who've got NIHR backgrounds, but you know, spice it up a bit. So Lisa's just given you all the answers to these questions that I'm going to be posing following this short case study. But it's a rather sort of strange environment doing this virtually, because usually these things are done with a lot of toing and froing, and this is a bit like delivering a lecture in a library, and other than me occasionally asking if you're still there, we have no idea whether you're listening. So those of you who are listening, I'm just going to read out this case study. I know you can read it yourself, but it might be a bit difficult on the screen. And then I'm going to ask you a couple of questions about it. So as I understand it, and apologies for not knowing who you all are, but I understand that most of you presumably are some sort of general advisor or an advisor in some capacity for the RDS, presumably. nobody's nodding, so presumably you're not. You might be a load of plumbers and electricians, but let's assume you're RDS advisors for a moment, and I'll read this out. So this is somebody who comes to one of your drop-in clinics perhaps, and his name is Taz, and he's a researcher from Bristol, and he's applying to the NIHR's RFPB to do a piece of research that he's very passionate about. He's a former care assistant in a residential care home for the elderly. Taz noticed when working there that lots of the residents found it very difficult to communicate when they are in pain, often due to dementia, lack of language, or social embarrassment. Taz wants to secure funding to do some ethnographic work inside private residential homes to observe how staff and residents deal with issues around pain. He's come to the RDS not for PPI advice, but for methodological advice, as he is confident that given his background in care, he'll be fine communicating with the residents in the home. His PPI plan has been redacted by him on the grounds that it is both unnecessary, given the ethnographic nature of the study, and that it would be unethical to bring residents and residents with dementia out of their homes to attend meetings at university. He's chosen co-production as his PPI methodology and has already written the plan, so he doesn't need input on that either. So I hope that gives you a flavour of who he is, what he wants to do, and potentially the issues. So I've got 2 questions, and we're going to open up the mics. And when we open up the mics, if whoever speaks, if you can hear someone else speak, just sort of give way to that person, please. I mean, you have to it's a bit of a bum fight. You have to sort of work it out for yourself. So the first question is, you as an advisor, what questions would you put to Taz at the advisory session, having listened to his application? And specifically, we're talking about PPI here. Can someone open the mics? Buy it. Over to you, anybody? I told you we were in a library, nobody listened.
I think we listening just thinking, right? And because it seems, so the way it's presented, that it really does, does not want very much. Okay, it just wants methodological advice, but not from PPI perspective. But then we have to focus on PPI, so I'm a little bit that concerned. So, okay, because what we normally do at the first stage is to, just inquire about the research team. And I'm just thinking, all right, would this be the right thing to do in this situation? So just asking, on, first of all, who else is on board and what research team he has in mind.
Would you not want to know why he's redacted his PPI section?
Mm-hmm.
Yes, and I'd point out to him that he doesn't have to take residents with dementia out of homes to attend meetings at university. He could very easily have a meeting in a care home with people with various levels of dementia, and with carers and with the family and lots of other people.
Can you do me a favour? Can you just tell me what your name is when you speak? Because I have no idea who you are. And
Sorry, that was Wendy. I'm Wendy.
Well, hello, Wendy. Is that Wendy Woodpert?
It is. Hello. Hello.
Hello, Wendy Wood.
Hello.
Very, very sensible suggestion. Hello. Hiya. So very sensible suggestion. Thanks very much. What else? Who else? Anyone else got any thoughts on this?
This is Katie here. I was just wondering, I'm getting the sense from the description that there's maybe some kind of principle involved here that Taz is not very keen on PPI. So I would almost wind the conversation back from the specifics of the project, which he'll be very attached to because it's his, and kind of get him to talk and open up a bit about what his thoughts are and understanding is of PPI and co-production, and maybe try and get a discussion going with him that's outside the specific project, because I think if you start kind of tackling or challenging him about his ideas or his project, he's going to be naturally quite defensive. So maybe I'd start and see if there's any open ground on just having a bit more of an open discussion.
That's, sorry, remind me your name?
Katie.
Katie, that was really interesting, Katie, actually, because you do sort of get the flavour, don't you, from this, that to say he's not keen or he's a bit dismissive or he doesn't think he needs it. I mean, it's clear, isn't it? And I think you've picked up on something really important, which is this question about co-production as his PPI methodology, and yet he doesn't have a PPI plan, he's redacted it, and he doesn't think it's necessary. Those two statements don't appear compatible, do they? Anybody else? Let me just move you to a different question then. It's along the same lines, which is that there are some issues buried, not very hard. They may be stepping a little bit on James's toes, apologies for that. But there are some issues buried in here. Are there particular things you'd want to draw out when you're having your advisory session with him?
Hi, it's Frida Mould here. Hello.
Hi, Frida. Hiya.
Hi. I would probably just start with, you know, what's the end point of his project? I mean, how can people inform on the different aspects? So, you know, what does he want from the group? How are they going to improve the study? So I would, I mean, you know, his opinion of PPIs would be the very starting point, but I would move on to kind of, you know, which bits of the study would highlight the weaknesses of what he wants to do. Lots of things, really.
Okay, yeah. Anybody else?
I'm based in here. I was quite interested to see that he's chosen co-production as his methodology, but clearly based on other comments, perhaps he doesn't have the correct understanding of what that is, and that you're in danger of having some tokenistic PPI there labelled as inappropriate as co-production.
Yeah, that's really interesting, isn't it? Because I think what happens is sometimes, yeah, I mean, you know what it's like in advisory sessions, what you see on paper and what you hear when you have a conversation with someone are two very different things, which is why on ethics committees we have the luxury of interviewing the applicants, and on funding committees typically we don't, which is a shame, because you can sort of see behind the words. People drop words like co-production into their plan, and you as an advisor might feel comfortable and confident because they've used the right word, and yet when you scratch the surface you find that there's a confusion at best and perhaps a hostility at worst. So yeah, that's and you wouldn't expect co-production to be tokenistic, and yet it could be. Yeah, thank you. How are we doing for time? For Arno, or has somebody, Emma?
You have about 5 minutes.
That's okay. Okay, anybody else?
Just it's Wendy again. Just he seems to think that PPI is all about communicating with the residents in the home, which is he clearly doesn't know what PPI is, does he? And it doesn't understand how much it could inform the whole study rather than just being able to communicate with the residents.
And in a study like this, it couldn't be more important. These are people with dementia. They can't communicate very well, possibly anyway. We know they can't communicate around pain, so perhaps they can't communicate around other things. There's a mental capacity issue, potentially. There's all sorts of ethical issues, and there's PPI issues, and clearly there's a methodological issue in terms of the ethnographic work. So, okay, thanks very much for that. I hope you found that vaguely interesting. Lisa, can you just, if you've got control, go on to the next slide, please? Thank you. So this is just a thing that we put together, just giving you some tips. I mean, there's loads, and we could have gone on forever, but we've only got one slide. So practical things. So things like, you know, the meetings, the accessibility of buildings, communication time, the study just earlier about bringing people with dementia out of their care home into university as a classic example of, you know, we think in terms of meetings all happen in a university, and perhaps now we're going to think more flexibly because of this. But in PPI, we've always had to think flexibly because not everybody can get into the buildings, and, you know, you need a hearing loop or whatever you need. The communication just along the lines of what Lisa was saying about asking how people like to be addressed, you can find out their preferred method of communication. Similarly with technology, this is all very well and we apparently are managing it reasonably well, but not everybody has access to it or the skills to do it. So this is important. This is about where do you find people and where do you advise your clients to find people? And I'm sure this is a question you get asked. Certainly PPI advisors at RDS get asked it all the time. You know, who do I ask, where do I find them, and how much do I pay them? Seem to be the top 3 questions. And our tip is really always think local. Going to a national organisation, one isn't necessarily the best way, say going to Age Concern or Mind or any of those organisations. And they're not necessarily representative any more than anybody else is of the population. What you really want is what I would call a real person. So it's easier perhaps and better in many respects to go local. Payments, you don't really need to get embroiled in that, but you do need to make sure that your researchers realise they do have to think about things outside just payment for time, so carers, etc. I think the relationship building's really good. As you build relationships with your clients, you want your clients to build relationships with their PPI advisors, their lay advisors.
Thank you.
Sorry,
Nice.
just if someone's mute. Can you mute your mic, whoever's speaking, please?
Well, I'm.
Hello, sorry. In doing that, they muted everybody. Hopefully you can still hear me. So the relationship buildings couldn't be more important. The log of the PPI is just something which you can encourage people to do really early, so at a pre-grant stage, to start logging their PPI so they can track it for impact, because that's one of the things that they'll have to do in their report if they get funding. And secondly, and most importantly, perhaps, encourage your clients to get to know their lay advisors and get creative with it. It's one of the few places where researchers can really be liberated to be creative with who they work with and the styles they work, and they don't have to get too hung up on, you know, methodological issues and regulatory issues in some senses. Because at the moment, PPI is almost a regulation-free zone. It won't be for a while. It won't be forever, but at the moment it is. Next slide, please. And these are just things to take away. I think you're going to get the slides at the end, which are just some hints from the experts, which you may or may not want to look at. And then I think we're probably on for questions now. How long have we got?
There's about 5 minutes. Well, we've got about 4 minutes for questions now, if that's okay. So I can see one's popped up from Julie. Julie, would you like to open up your mic and ask Jennifer your question?
Yes, it was just I am interested on we do sort of measure impact within the RDS, but we kind of advise people to give feedback to their public contributors on how things have changed and to document it. But I just wondered if you actually had some kind of template or guide on having a log of PPI activities, because I think that'd be quite helpful for researchers.
Right, so sorry, Julie. So as far as I know, we don't, but it's, when I say a log, it's a sheet of A4. Okay. I mean, the idea is that, you know, we're trying to encourage the impact of PPI to be quantified in some way. That's throughout the study. It's just the idea is if you set your clients on a path before they've done their funding application and through their funding application and through their study, then they're going to have it ready for when they actually have to submit it. So it's, I mean, a log might be a grandiose title. People used to call it something. I shortened it to log, but it's just a sheet of A4 on what they've done. They might want to record some sort of challenges, you know, recruiting PPI advisors or whatever they are, and what impact it made. That's all it is, nothing more than that. So just design your own for whatever your client.
Okay, thank you. I had one other question as well. Have you seen the new NIHR brief guide to public involvement in funding applications?
Oh, well, that would be Lisa's question.
Ah, okay.
No, that's not something I've yet seen, Julie, so I'd be very welcome if you'd share that.
I can put the link in the chat. I would just be really interested to understand included social care, or if there was anything missing. I think they've updated it for times in COVID. I'm not sure, but I was told that they were, or they were going to. But I think it's meant to be a very, very useful guide. I've seen it, it looks quite good. It's very recent, so it'd be good for you guys to have a look and let us know if you think it captures social care as well.
Wonderful. Yes, I think we'll pick that up, Julie, and have a conversation with you. Thank you.
Thanks.